Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department, giving our weekly update on COVID-19. And Dr. Bogan will be giving the report, but the cases still remain what they were about a week ago. And while not rising, we don't see them dropping considerably just yet. What we do see now is we've gone over the 800,000 mark in vaccinations. 727,000 people who have been fully vaccinated, and about 74,000 people who have been partially vaccinated. We've also seen over 43,000 people who have received a booster shot. So people, again, we're good to see those vaccination numbers rising because we know, and the data shows it both locally, statewide, and nationally, that protecting each other, protecting ourselves with the vaccine is by far the most effective way of dealing with this pandemic. So let me turn it over now to Dr. Bogan to give her weekly update. Dr. Bogan?
Thank you, County Executive. And good afternoon, and thank you for joining us again today for our COVID briefing. Let me start with the numbers, which really haven't changed much since last week. We're still seeing around 350 to 400 cases a day, and that's really been steady for a couple of weeks now. So I think we've sort of reached a plateau, but we've not yet seen a drop in our cases like other parts of the country have. Our case investigations also really haven't changed much over the last several weeks. We continue to trace our cases back to social events where very few mitigation efforts are practiced. We had cases this week connected to weddings, family gatherings, indoor parties, and many sporting events, from youth sports leagues to professional sporting events. I'll remind everyone to please be thoughtful when you're attending events or gatherings. When doing so, please wear a mask, especially if you're indoors, but even outdoors if you're in crowded places. And please wear your mask properly. Seems weird that I have to say that after 18 months of a pandemic, but I did travel this weekend, and while most people were wearing masks properly, I continued to see people with masks around their chins, with their nose exposed, which of course, really, they serve no purpose whatsoever if they're not worn properly. So once again, masks should cover your nose and mouth and should fit snugly, so there really are no gaps around the outside of the edges. And it's really helpful to have a mask with a nose pinch because that really helps the mask from slipping down the nose over time. Because we continue to get reports of misinformation, I want to take a moment to review CDC guidance regarding isolation, quarantine, when to return to work, and why follow-up tests are not recommended. Again, I know we've been through this. It's been a long pandemic, but we continue to get misinformation, so I feel it's important to review this again. Isolation is what you do when you have an infection. If you test positive for COVID-19, regardless of your vaccination status, you must isolate for 10 days from the onset of symptoms, or if there are no symptoms, from the date of the test. Some people who become seriously ill or are immunocompromised may have to extend isolation to up to 20 days, but for most people, 10 days is enough. The final determination should be made in consultation with your doctor. When your isolation is over, you do not and should not have a repeat COVID test. The PCR test can remain positive long after you are no longer contagious, so getting repeat testing can be misleading and waste resources. Quarantine is for people who are exposed and waiting to see if they develop infection. If you are not vaccinated and were in close contact with someone with COVID-19, that is, you are within 6 feet for 15 minutes or more, you need to quarantine. Quarantine duration may end after 10 days if no symptoms to develop, or after 7 days if no symptoms to develop and you receive a negative result from a test performed 5 or more days after the last exposure. And PCR tests are the preferred method of testing for that testing. People who are fully vaccinated do not need to quarantine after contact with someone who had COVID-19 unless they have symptoms. However, fully vaccinated people should go get tested 3 to 5 days after their exposure, even if they don't have symptoms. and they should wear a mask in public for 14 days following exposure or until the test result comes back negative. So again, if you test positive, regardless of your vaccine status, you isolate for 10 days after the onset of symptoms or date of positive test. Tell your close contacts that they may have been exposed and should quarantine and get tested. And please respond if and when the health department staff contact you for case investigation or contact tracing. If you receive conflicting advice from a testing location or pharmacy, you can call 211 or the health department for us to answer your questions on proper guidance. Next, let's talk about Halloween. So Halloween is fast approaching, and many people are seeking guidance on how they can celebrate as safely as possible. Much of the following guidance I've said before, so nothing new here. First, practice physical distancing. If you're having trick-or-treating, try to avoid crowds and maintain at least 6 feet of separation. And of course, it's best that everyone wears a properly fitting mask during trick-or-treating. If you're giving out Halloween treats, remember what many people did last year, which is to have containers sort of sitting outside for children to select that treat, so you're not coming in close contact with lots of people who knock on your door. Last year in my neighborhood, quite a few people were very ingenious and set up pipes that went down railings. One guy set up a chute from his second floor. However you want to do it, but those are just some ideas. If you're attending or hosting a Halloween party, remember that outdoors is always better than indoors, and that if you do have an indoors, try to keep your windows and doors open to increase circulation. Finally, this wouldn't be a health department briefing if I didn't remind you to get vaccinated. As I explained last week and many weeks before, the vaccines work. They help protect you from serious illness, hospitalization, and death. For those at increased risk and those 65 and older, I'll please remind you to go get your booster vaccine if you are eligible. Beyond that, this week is largely one in which we are looking ahead. We continue to look ahead and wait for approval for vaccines to be administered to those under age 12. We continue to await a drop in cases in Allegheny County, which I believe should come soon. And we continue to urge everyone not only to get their COVID vaccine, but to get their flu vaccine, which again, like I said last week, you can do at the same time. So even if it doesn't feel like it, sometimes I think there is cause for optimism. Please remain vigilant, get vaccinated or get a booster if you're eligible. Wear your masks and consider your personal and community risk in all your decisions. So thank you for your time. Please be safe and be kind.
We will begin questions from the media now. The first question comes from the Post-Gazette. Can you comment on the county reaching over 126,000 positive COVID cases?
Well, that number sounds like it's more than 10% of our Allegheny County population, so that's a milestone, I guess. And, you know, we continue to see cases, so I ask people just to remain vigilant.
The next question comes from Public Source. Should the Pittsburgh Penguins require people attending their games to wear masks, considering the games are indoors and the county is currently in high COVID-19 transmission? Is the health department concerned, is the health department concerned that unmasked fans in the arena will lead to increased COVID-19 spread?
Well, one of the things we've been very pleased with is that most of our institutions, including our professional sports teams, collegiate sports teams, have done a really good job of following CDC guidelines regarding events that they have, and we would continue to urge all of our institutions to do that, whether it be concerts, whether it be sporting events, whether it be other indoor activities, gatherings, indoor and outdoor, as to what they're doing. So again, I think everybody, as Dr. Bogan has said, can follow the CDC guidelines. If they feel more protected by wearing a mask, they certainly can do so. Hopefully most people will be getting vaccinated, because we know that is the best way to eradicate this pandemic.
The final question today comes from WESA. Could Dr. Bogan share any new data she might have regarding the outcomes among COVID patients who are and are not vaccinated?
Sure. I think let me focus on sort of the data around deaths in Allegheny County, since September 1st. Of 10 deaths among those less than age 50, 9 were people who were not vaccinated. Of 19 deaths among those 50 to 64, 16 were in people who were not vaccinated. Of the 95 deaths among those 65 and older, 61 were in people not fully vaccinated. I think this really points out the importance that our older generation should be getting booster vaccines when and if eligible. I do not have information about booster vaccines at this time by age group. I also want to point out that we don't know details about these deaths. So there's a lot of unknown, and we don't know about the deaths among the vaccinated or the unvaccinated. What I can tell you is when I speak to my colleagues that are delivering healthcare in the hospitals, that they tell me that nearly all or most deaths among those that are vaccinated are in those who are immunocompromised, so they have a weak immune system, are frail and elderly, and have underlying medical conditions like advanced cases of cancer. So again, it's very important when you think about these data not to say, well, we have a lot of breakthrough cases. The vast majority of deaths really are among those people who remain unvaccinated or those who are at very high risk with underlying health conditions. So again, remind people, if you're eligible for a booster vaccine, you're 6 months out from your second Pfizer vaccine, you should go ahead and get your booster if you fall in that group, especially 65 and older, have underlying conditions, and those that are immunocompromised should be getting their third dose as recommended by their doctors.
That was the final question. If there are any closing comments.
Thank you, Dr. Bogan, and I think that's really important information as people try to sift through the data about deaths that occur among vaccinated and unvaccinated, that even among the vaccinated people, those underlying health conditions really do affect the outcome. So folks in those conditions need to really be careful with wearing masks, social distancing, all the things that we've learned prior to the vaccine. But we do know that the vaccines work, and they've been just so effective in helping the vast majority, the close to 800,000 people in Allegheny County who have been vaccinated. That's why we've seen much better results than other places across the country, and we want to continue that to protect this community, to protect each other, and protect our families. I also am starting to see, again, I mentioned this last week, but more and more companies, private, nonprofit, public, et cetera, that are requiring employees to become vaccinated. And as we see more and more of that, it's protecting folks in the workplace, it's protecting those folks when they do go home, and certainly protecting those unvaccinated children that haven't been approved yet for vaccines, the 5 to 11-year-olds that now has been, the application has been made to the FDA, and hopefully there will be word by the end of the month that those folks will be approved, and we can start vaccinating and protecting the 5 to 11-year-old age group. So anyway, we are going to not do the briefing next week due to a scheduling conflict. We're not going to every other week yet. We're still going to continue every week, but next week there will be no Wednesday briefing, but there will be continued communication from the health department on any updates, any news that comes out, whether it's from the state, whether it's from the FDA, or whether locally that we need to deal with. But just wanted to make that announcement. So we will see you in 2 weeks, and stay healthy. Thank you.
That concludes the COVID-19 briefing. The next briefing will be on Wednesday, October 27th at 4 p.m.